Ultimately, clinical trials of any kind matter because without research, there are no improvements in care. Industry-sponsored trials, often late-stage trials as they're known, involve bringing innovative medicines to hundreds, if not thousands of people at the point at which, roughly speaking, you know they have some effect, but you're trying to measure that effect ahead of regulatory submissions and reimbursement and so on.
The MHRA is probably one of the most important regulatory agencies in the world for its pragmatism, for the reputation that he had. And we have to remember that the MHRA was the first agency to approve a COVID vaccine during the COVID pandemic. And that is self-explanatory, I would say. It's remarkable.
So Moderna has an extraordinary story as a biotech. We're about 13 years old, and we were put together to really try and understand the promise of mRNA technology and the value it could bring in the development of vaccines and therapeutics, new medicines. We all became aware of mRNA during the pandemic, and that's in part because the work that had been done a decade prior to the pandemic enabled our researchers to develop a vaccine unbelievably quickly.
Commercial trials bring new money into the UK, foreign direct investment. Most pharma companies and biotechs are obviously headquartered outside the UK. They're bringing trials here, and that means they're paying for the cost of medicine, they're paying for the cost of care. And in the review, we estimated that this is worth hundreds of millions of pounds in additional funding if we were to double and then double again our clinical trial activity in the UK.
We work with the international community as well, so we can benchmark ourselves and we can learn from the other, and we can exchange best practice as well. And all together is allowing us to be in a very good position to support the life ecosystem and the research ecosystem in the UK.
The UK stuck out to us really very prominently. It has an incredibly progressive regulator. The quality of the clinical trial work done in the UK is very, very high. We have excellent data access records through the NHS, and everything combined, along with an extraordinary willingness and enthusiasm to invest in the life sciences sector, meant that the UK was an obvious choice.
So the things that you know you're going to get with the UK, you know you're going to get some of the world's leading clinicians who will be involved in your trials as investigators and so on. That's a given. Access to our science base, robust data that's regulatory grade. So there's lots of things they know what they will get. And my experience has been life sciences companies, they'll want the UK to be part of their roster.
Commercial, they have always safety as a paramount, as we do. But for them, time is extremely important. Therefore, having the reassurance that the agency is supporting the development according to a specific and detailed time frame for them is essential.
The MHRA have really been a world-leading independent regulator. We've also seen the importance in the UK around running very diverse clinical trials, the way they rallied during the COVID-19 pandemic, and the way they set up patient awareness and information was incredibly impressive.
If trials are hard to set up, if it's difficult to find trial centres, difficult to recruit patients and so on, that tends to suggest that things aren't working. Equally, if all those things are working, if trials are straightforward to set up, you can find sites and fill them quickly, that suggests that the system is working well, which will then attract other investment in early stage R&D and manufacturing, drug launches and so on. So it's not the be all and end all, but as I said, it does speak to the health of an ecosystem.
Oh, the future at Moderna is incredibly exciting. And I'm really excited that we've chosen to build this very unique Moderna Innovation and Technology campus here in the UK.